We now move on to the treatment phase. Now, it's quite important to remember before we start the treatment, it's crucial to have effective and an appropriate diagnosis. We need to have completed a proper objective physical exam, and we also should have by now had a proper and a full subjective interview process. Now, if we have missed out or cut corners in any of the initial three phases of the process, we're not going to be able to deliver a proper treatment session. Now, before the treatment session can begin, it's important to remember for the physiotherapist that this patient has probably been to multiple other professionals in the past. They've probably had multiple GP or specialist appointments. They've probably spoken to a lot of their colleagues at work, their family members, their neighbours, and they probably have even spent a significant amount of time searching things online. So, what the patient is expecting and what you want to deliver might be two completely separate things. And to balance things out, it's important to just educate the patient. This is what we're going to do, this is how it goes, and this is the potential outcome of this particular treatment. Once you are both on the same level, it's going to make the treatment a lot more successful. Now, in terms of treatment options, we have multiple things that we can try, and it's important not to employ too many techniques very soon. So, if we start using a lot of different techniques, it's going to confuse us because we won't really know which treatment has been the most effective. So, for example, a lot of the younger therapists, the new grads, they love using multiple techniques because their minds are full of ideas. They've just come out of uni as well. And often they are left a little bit disappointed when the person gets off the treatment bed and says, "Hey, I'm actually no better right now." Now, it's important to remember, even though the patient has told you they're not feeling better, their objective signs might be a lot more. What that means, they might be able to walk further than they could before the treatment section. They could possibly drive half an hour more than they could. They could potentially sit and work on the laptop half an hour more than they could before. All of these things are related to the treatment, and these are positive signs that the treatment is working. Um, by the end of the treatment session, we need to work with the patient and deliver a bit of a plan for them to follow, which might include some exercises and the frequency of the treatment, and all of this is done after the treatment is over.